This Sunday is World Mental Health Day and is recognized internationally as a day to raise awareness, promote education, and advocate against the social stigma surrounding mental health.
In honor of World Mental Health Day, UNICEF just released a critical report which found that children and young people could feel the impact of the pandemic on their mental health for many years to come. Thank you so much for staying with us. I'm Vanessa Freeman.
I'm Corey Chambers, and for Tamsin, UNICEF also says the pandemic may just be the tip of the iceberg when it comes to mental health. According to the report, more than 1 in 7 kids worldwide are estimated to live with a diagnosed mental disorder.
Almost 46,000 kids die from suicide each year, which is among the top 5 causes of death for their age group. But only 2% of government health care budgets are allocated to mental health spending.
Joining us today is Zeinab Hijazi, Senior Mental Health Technical Advisor at UNICEF. Zeinab, thanks so much for being with us to chat.
Hi, Corey. Hi, Vanessa. Good to be here.
All right, so let's talk about these findings for a second, because I think a lot of us think of kids as being very resilient, but obviously this is COVID, especially, has really disrupted their lives in so many ways. What can you tell us about the impact on kids?
So first, maybe really quickly to say as well that, the State of the World's Children report, which focuses on mental health, emphasizes UNICEF's approach to mental health, which embraces, this shift from thinking about mental health in biomedical terms, where the focus is on conditions to be diagnosed and medicated, where you are either mentally healthy or mentally ill. Instead, mental health needs to be understood as a continuum. At any stage of our lives, any one of us may find ourselves at different points on that continuum. And so the report recognized this and the impact that COVID-19 has had on our children, but also before COVID-19. The mental health and the burden of mental illness has had a dire impact on our children for many decades. And so it was important to embrace this continuum and emphasize how risk and protective factors in the home, in schools, and in community shape mental health outcomes for children. And examples of protective factors are loving caregiving within homes, safe schools, and positive peer relationships, while risk factors can include the impact of COVID-19, poverty, abuse in the home, or humanitarian situations and emergencies. So really what happens in childhood builds the foundations for good mental health throughout the life course. So the argument is that the best return comes from investing early and the need to focus on prevention and promotion as part of a broader preventive, promotive, and treatment continuum.
Right. And Zeinab, we know there are a host of pressure points here, some of them you just mentioned, but what did the report find in terms of a solution, and what is UNICEF calling for in order to really prioritize mental health in kids?
So for UNICEF, the key issue of the moment is mental health. We chose the subject for the State of the World's Children report, and it was identified as one of 4 priorities for the agency over the coming years, even before COVID-19. But what the pandemic has done is highlighted even further the essential inclusion of mental health and psychosocial support across sectors and across the lifespan. It has also highlighted the dire gap between the great need and the lack of corresponding attention from political and financial investment. So UNICEF, what we have done is we've elevated mental health as a global advocacy, programming, and research and data priority for the next few years. We set out a clear agenda for action, and which we highlight as recommendations within the report. We're working to increase and improve the quality of investment in child and adolescent mental health across all sectors. So not just in health sector, where we are often used to seeing expenditure take place. We want to be looking at a whole of society approach that prioritizes spending and investment on mental health in schools, in healthcare, but also in social services and protection. Second, we're working to ensure that children, adolescents, and caregivers and families have access to the care that they need, and that their human rights are served through laws and policies. And this, of course, can be done by a sustained and competent workforce and integrating and scaling up evidence-based interventions across the sectors that I mentioned earlier, including primary healthcare and schools and social services. But it also, very importantly, it includes parenting programs and the need to support that so that we are looking at responsive, nurturing, caregiving, and support, and at the same time prioritizing parent mental health, and of course ensuring schools support mental health through quality services and positive relationships. And then second, we know that effective responses require accurate data and robust research. So we are working to fill the data gap through population level data collection tools. And finally, we are working to fiercely amplify the powerful and persuasive voices and actions of youth, caregivers, and service users who are increasingly leading transformative change in their communities. Really, it is only this way that we can successfully address stigma and promote better understanding and action in mental health. So really by taking seriously the experiences of children and young people, and by mentoring the next generation of mental health advocacy and policy changers.
You know, it's an important issue that I think all of us got to talk about and got to get better about talking about. Zeinab, thank you so much for taking the time out to speak with us about it today. And really, look, it's something for us to think about, something for lawmakers to talk about and think about, and educators, everything. It really is. The solution is going to be across the board, not just through one person or one entity. Thank you so much again, though, for the time.